Hi there, it's Dr. Kelvis with Liberty Family Medicine, and I'm here to answer the question, should I get the flu vaccine during the COVID-19 pandemic? Very valid question. I really applaud my patients that don't just blindly, do whatever the government or healthcare tells you to do. Um, Vaccines are not a benign thing. So, with flu vaccines, yes, you need to get it. Absolutely. Every single year. Um, Keep in mind, so the flu and COVID, even though they present the same way, they are two totally different viruses. Um, in 1919, we had our first, I guess, epidemic, right? The Spanish flu. And we dealt with it the same way that we are now with social distancing, vaccinations. Thankfully, now we have so much more technology that we can better prevent the spread of disease. But um, yes, you absolutely need to get the flu vaccine. So, when you are 65 years or older, or, depending on what comorbidities you have, and again, talk with your physician about that, you need to get what's called Pneumovax. If you have chronic heart disease, so not high blood pressure, but like heart failure, heart disease, if you've got chronic liver disease, like alcoholic cirrhosis or chronic hepatitis B and C, or NASH, which is non-alcoholic steatohepatosis, that's from having a lifetime of say diabetes or high cholesterol, so chronic liver disease. If you've got chronic lung disease like COPD or emphysema, if you've got diabetes, or if you've been a smoker for a long time, those are some of the chronic conditions that would qualify you to get Pneumovax earlier. Uh, and Pneumovax is different than the yearly flu vaccine that you get. So a couple more vaccines that you should also just kind of ask your doctor about, since you're going to see them for all these vaccines. Make sure you're up to date on your tetanus, your diphtheria, your pertussis. There still are cases of whooping cough in this country because a lot of people aren't getting vaccinated or aren't vaccinating their kids for it much anymore. Ask about shingles vaccine. Um, so the and COVID being annual, I get asked that a lot. We are not quite sure yet how long the COVID vaccine will last in your system, or how long the antibody response will be there for. With vaccines like hepatitis B, for the most part, that's a lifelong immunity. But vaccines like hepatitis A, they only last for 2 years. So hopefully, COVID is something that lasts long term. I think it's very likely that it will be a yearly thing, similar to the flu.